Well, good morning. It's Bruce Williams, and it's a Friday, so it's time for Gross Path Challenge number 9. While you're getting your pencils and pieces of paper ready, I am going to thank all of my friends and colleagues once again who have provided me images over the years and allow me to put these lectures and Gross Path Challenges together. Okay, let's start with slide number 1, and this is tissue from a Rhesus macaque. I would like for you to give me a morphologic diagnosis and the cause of this lesion. Take about 90 seconds. Think it through, put down your best answer, and then we'll go over it. Okay, we're looking at a combination of some superficial and some very deep ulcers on the tongue, on the lips, even on the nasal planum. So my morphologic diagnosis would be a multifocal to coalescing, necrotizing glossitis, cheilitis, and nasal dermatitis. Now, if you said ulcerative, I would be very happy with that. On a mucosal membrane, an ulcer is simply necrosis. So I can use the two interchangeably, not have too much of a problem with that. The cause of this is a virus that has undergone a lot of name changes over the years. First it was B virus, then it was cercopithecine herpes virus 1, and most lately it is macacine herpes virus 1. This is a very dangerous virus which has resulted in about 24 cases of fatal encephalitis in humans. It got its name B virus, if you like history, by the first fatal case in a human. It was a researcher who was working with primates. No, his name was William Brebner, and so it got the B virus from his last name, Brebner. And he was bitten on the hand and eventually died of a progressive encephalitis. And this is the problem with alpha herpes viruses, especially primate herpes viruses, when they do tend to jump from species to species, and when they jump from one primate species to another, especially to humans, they will cause a progressive fatal encephalitis. And luckily we haven't had any cases of this in the 2000s. People are very aware of that. It is one of the reasons to be extremely careful with your personal protective gear, double glove, triple glove when you are working around monkeys. It is not just transmitted by bites. It can also be transmitted by saliva splashes. So face masks are certainly required when doing any type of monkey work or monkey post. This is a bad thing. On a related note, we can see cases of fatal encephalitis in species other than primates. Rabbits can catch human herpes simplex virus. Don't kiss your rabbit, because rabbits are very susceptible to it, and it can jump species, and that particular virus that only causes cold sores in people can cause a fatal encephalitis in rabbits. In the normal host, which is not immunosuppressed, most cases of B virus infection will cause ulcers in the mouth and on the genitals. Animals that are very young or immunosuppressed may get a systemic, even fatal infection. Okay, so much about B virus. Let's go on to slide number 2. Slide number 2 is tissue from a goat. I would like you to name the condition and give me a microscopic description. Okay, time is up. This is a very interesting incidental finding in Angora goats. And you can see that the cortex is very dark, and the basement membrane around all of the tubular epithelial cell of the renal tubules is discolored, a dark bluish black, and this condition is known as Klaussen kidney, after the Klaussen jewelry. And if you don't know what that is, you may want to Google that. And the microscopic appearance of this is a darkening of the tubular basement membranes due to a deposition of hemosiderin and ferritin pigments. So these are iron pigments that are in the basement membrane. It doesn't cause any problem with the kidney. It's just an incidental finding and a very striking, gross picture. Okay. Slide number 3 is tissue from a rabbit, from my old friend Dean Percy, who published in his book, and I think it still is. And I would like for you to give me a morphologic diagnosis and a cause. Okay, time's up. We're looking at the viscera of a rabbit. We have the liver on the left, the stomach, and here is the small intestine. Down here would be the large intestine and the cecum. This is all small intestine. And the gross appearance of this small intestine in this adult rabbit, or maybe it's a juvenile rabbit, but it's not a kit, is that it has a cerebriform appearance, more severe in probably the caudal aspect of the intestine, but you can start to see it up here in the jejunum as well. There is one species in which some wrinkling in the ileum is an okay finding, and it's normal, and that's the pig. This is not a pig, this is a rabbit. The intestine itself looks a little thick, and it looks like there are liquid contents in it. This is a case of Lawsonia intracellulare infection, and rabbits are a little bit unique in the way that Lawsonia affects the intestine. It does affect the ileum first. It affects then will affect the small intestine diffusely. And the difference between rabbits and other animals that get Lawsonia is that you have a particular histiocytic infiltrate. Normally, when we look at Lawsonia in pigs or hamsters, we see a tremendous proliferation of the epithelium, and it forms this sort of glandular pattern. And that happens too in the rabbits, but on top of that, to give you this very cerebriform swelling of the intestinal mucosa, you get a profound histiocytic infiltrate. And that's the only species that gets that. So the proper morphologic diagnosis would be a diffuse, proliferative, and histiocytic enteritis. Rabbits are one of the outliers with Lawsonia getting the histiocytic inflammation, which no one else gets. The other outlier is the ferret, in which the infection appears in the colon rather than small intestine. Most of the other species get it in the small intestine. I would certainly know about it in pigs. It causes a tremendous problem in pigs, and it manifests either as intestinal adenomatosis, necrotizing ileitis, or porcine proliferative and hemorrhagic enteropathy. So it has a couple of different looks. It causes wet tail or necrotizing ileitis in hamsters, proliferative colitis in ferrets, and it will cause a protein-losing enteropathy in foals. Okay, on to slide 4. This is tissue from an ox. I would like a morphologic diagnosis and a cause. Okay, time's up. This is a tough one. We need a morphologic diagnosis and a cause. Well, we're looking at, obviously, the incisors of an adult ox, and you can see that the enamel has broken off, exposing the dentin in many areas. The dentin itself has chipped, and if we look very closely, there are some defects in the dentin. Okay, so, but the lesion is primarily enamel. So this is multifocal coalescing enamel hypoplasia and dysplasia, probably more dysplasia. And the cause of this is fluorosis. Okay, so fluorine is a environmental pollutant around aluminum manufacturing plants, some fertilizer plants, and it will get into the groundwater, and affected animals in the area will take up fluorine. And fluorine has a very similar structure to calcium. It has 2 unpaired electrons, and when it gets into the body, it will very happily substitute in the areas that calcium normally substitutes. Luckily, it doesn't cause problems in the blood or the muscle or something like that. But in long-term repositories like bone and enamel and dentin, it will exchange itself. In the bone, it exchanges itself and incorporates itself into the hydroxyapatite crystalline formation of bone. The bone becomes very chalky, very brittle. It is not the same bone that you get with a healthy incorporation of calcium. Same thing with the enamel. So the enamel is very brittle. It will be formed, but it will rapidly chip off, and there are some defects in the underlying dentin as well. These animals often will manifest with very thickened metacarpals and metatarsals, the weight-bearing bones in the legs, and you'll have a tremendous periosteal reaction because that bone itself is somewhat fragile, and so the body will put down a lot of it to try and stabilize that. You can see it in other species as well. There was an excellent paper with a very unusual lesion in the stomach of rabbits that was intoxicated by fluorine, published a number of years ago in VetPath, where they got this dysplastic or dystrophic mineralization of the gastric lining, and that's a great image and one that you probably should go back and look up. So this is fluorosis and a problem with environmental contamination in cattle. Okay, 5th slide is from a pig. I would like for you to name the disease and another affected organ. Okay, time is up. We're looking at a pig, and it's covered by large raised plaques. And the plaques appear black, but actually, if you saw a very new plaque, these go on the abdomen and up over the flanks, obviously. And if you saw a new plaque, it'd probably be sort of pink or reddish. And what happens with these animals is they get a lot of dirt there. And this animal's been kept, obviously, in some dirty hay, and the dirt gets stuck into the exudate on these plaques, and it turns the whole thing sort of a blackish color. So some of you might have said, oh, this is a melanoma, and this is one of these animals that have congenital melanomas. I probably have to give a little partial credit for that, but you can see at the edges there is these plaques are raised, they're discolored. So you have to see this a couple of times to really pick up on it. Okay, so if you said melanoma, I'm going to give you a couple points. But this is a condition known as dermatosis vegetans. In the skin, it causes a sort of eosinophilic and psoriasiform, meaning a very proliferative dermatitis. It also affects the lung and causes a giant cell pneumonia. This is particularly seen in landrace breeds of pigs, or landrace mixes, which are white pigs. And it's something that usually when it's seen, the animals are cold, and everyone says, we've done away with dermatosis vegetans, and every couple of years it pops up again. So dermatosis vegetans, and in pigs, the distribution is everything for many diseases. So this one, you can always see it's on the abdomen, but like pityriasis rosea, but it always goes up over the flanks, and it tends to get discolored by the stickiness of the environmental soil around it and turns black on a white pig. Okay, slide number 6 is from a cat. How about a good morphologic diagnosis and an associated lesion in this cat? Okay, time's up. We can see that the metacarpal pad on this paw has, it looks like it was inflated and then someone let some of the air out of it. There is a fine network of whitish wrinkles like a patina to it, and that's very characteristic of this. This is a condition that is known as plasmacytic pododermatitis, and if you take a biopsy of this and look at it, you're going to see large numbers of plasma cells. It often has to do with systemic plasma cell disease. So associated lesions might be plasma cell stomatitis, which goes by a number of names today. Once the dentists get involved, who knows what they're going to call it? I've seen it called necrotizing and ulcerative gingivitis. But the characteristics of plasma cell pododermatitis is that it is a bilaterally symmetrical ulcerative lesion over the palatine arches surrounding the fauces, which are the openings of minor salivary glands. And once again, if you biopsy it, you'll see a lot of plasma cells. And then another possible lesion that you'll see in a percentage of these cases is glomerulonephritis. You know, if you have something that's producing all these plasma cells, they're going to produce antibodies. And if they're producing antibodies, eventually you're going to get an imbalance of antigen-antibody complexes, and they will start to precipitate out in blood vessels around the body, resulting in glomerulonephritis, because the glomerulus is the largest capillary bed in your body, even bigger than the capillary bed of the lungs. So plasma cell pododermatitis, when I was in practice in southern Georgia, we used to call this pillow foot. Okay. Number 7 is an oldie but a goodie. Someone probably should have blown all the dust particles off before we scanned it, but this is tissue from a duck. I would like a morphologic diagnosis and a cause. Okay, time's up. The reason I like this picture, and I have better pictures of this, is because you're looking at the lesion from the outside, and it's very obvious from the outside. Ducks have circular Peyer's patches in the intestine, often at the entry of the ceca, and it's an annular band of lymphoid tissue. And this is diffuse Peyer's patch necrosis. It looks hemorrhagic. Remember that when you see hemorrhage, you want to think about necrosis, because there are very few true hemorrhagic lesions in nature. And nothing else looks like this, these annular bands of hemorrhage and necrosis. And it's associated with a gnatid herpes virus 1, the causative agent of duck viral enteritis, also known as duck plague. And there's a plague on the ducks. You'll get large numbers of dead animals. It starts with lymphoid necrosis. Eventually you are going to get necrosis of the entire mucosa, and the animals will die in large numbers. But it's a very characteristic lesion in a duck, preceding a massive die-off from duck viral enteritis. Okay, here is slide number 8. Slide number 8 is from a lamb. Let's go with a morphologic diagnosis, the cause, and name another affected organ. Okay, time's up. This tissue's from a lamb. It was the biggest and the strongest lamb in the flock. It was my best one. And now it's not good for much of anything except to take pictures. Okay. What we see when we look at this section of brain is we see a bilaterally symmetric lesion affecting the thalamus, this area of the brain. I want you to stop right there. When you see a bilaterally symmetric lesion, I want you to think about two things. I want you to think about metabolic or toxic injury. Viruses don't cause symmetric lesions bilaterally. Bacteria don't. They're more random. So we can usually think about toxic or metabolic injury. This is and we'll keep it fairly simple. How about a multifocal to coalescing bilaterally symmetrical encephalomalacia with hemorrhage? It's a classic lesion, which is known as focal symmetric encephalomalacia. I wish they'd change that name to bilaterally symmetric encephalomalacia because it's a toxic lesion associated with infection of the animal by Clostridium perfringens type C. This is an animal, probably the best in the flock, that someone was either pushing food to get better weight gain, or maybe just pushed everyone out of the way and got into the concentrate and ate too much concentrate, and then there was an overgrowth of Clostridium perfringens type C, which has a number of very bad toxins, including epsilon toxin. Some of the toxins, like beta toxin, will cause, and alpha toxin will cause necrosis within the intestine, and this opens up the body for the epsilon toxin to get into the bloodstream and go all over the body and cause endothelial damage. And so we have endothelial damage very characteristically in certain parts of the brain, like right here, but you'll see it also in many other organs as well. And so you could have given me just about anything. What I was looking for was intestine, but you're going to see hemorrhages throughout the body because it is not particularly selective as to what type of endothelium that it's going to go after. So the other organ was intestine, but if you put just about any organ, I'm going to have to give you full credit for that. Focal symmetric encephalomalacia. Oh, excuse me, I said it's Clostridium perfringens type C. I don't know, need to get a little more coffee. This is Clostridium perfringens type D. If you wanted to mention pulpy kidney, or kidney is the other organ, it is known as pulpy kidney disease, but that's probably just precocious autolysis. But you're going to see hemorrhages in there as well. Okay, so Clostridium perfringens type D. Let me get a refill on the coffee here. I'm going to come right back. There we go. And let's go on to slide 9. Oh, a great picture. This actually was published back in VetPath, I believe, back in 1995. In my heyday, and this was published by Dr. Tom Van Winkle of the University of Pennsylvania. And this is a dog. And I want you to give me a morphologic diagnosis and 3 possible causes. Let's challenge you on this one. Take about 90 seconds. If you don't need all 90 seconds, you don't know the answer, don't sit there for 90 seconds. I don't believe in the spontaneous generation of knowledge. Let's flip the cards on this one. This is a focally extensive portal vein thrombus. Sure, we're looking at the underside of the liver. You can see a huge thrombus here. This could also be this could be one of the pulmonary arteries or something. Those are the 2 places that are most commonly thrombosed. You have to look very quickly and do the autopsies very quickly if you're thinking about finding thrombosis, because in most of these animals, during the period of thrombosis, the entire coagulation system is going haywire, and you have both the thrombotic and the thrombolytic systems, both working in concert. So in these animals, thrombi are being formed and they're being lysed, and if you wait too long, you're going to miss thrombi. So if you think you have an animal in DIC, do not wait until the end of the day to do that post, or you're going to miss a lot of thrombi. This one might take a while to break down, but you might have missed a lot of smaller ones. Okay, so whenever we have thrombosis throughout the body, I want you to think of 4 particular reasons. One of them is steroids. Steroids inhibit tissue plasminogen inactivators. So animals that are getting high doses of steroids are in a thrombotic state. So that's always a good one. Pancreatitis. Pancreatitis will result in systemic thrombosis. Glomerulonephritis will do it, or any chronic kidney disease, because what happens is you are losing protein in the urine, and some of the anticoagulants will go out in the urine. So chronic renal disease. And then the last one is any type of neoplasia. Okay, especially neoplasms that tend to break off, that tend to metastasize, can often result in starting up a episode of disseminated thrombosis. Remember, little pieces break off, they adhere to endothelium, and that is going to cause disruptions in flow and all sorts of things, and you can end up with thrombosis. So, renal disease, pancreatitis, steroid administration, and tumors are 4 great causes for thrombosis in small animals. Okay, the last slide, number 10, is a sooty Mangabey. I'd like a morphologic diagnosis and a cause. Sooty Mangabey is the animal model for this particular disease. This particular picture appeared on the cover of VetPath in the late 80s or early 90s. And your time is up. Okay, morphologic diagnosis is a multifocal coalescing granulomatous facial dermatitis. This animal may have other nodules on maybe the hands and feet and the genitalia, but that's where they congregate, because these are the coolest parts of the body, and this particular bacterium likes the cool parts of the body. Sooty Mangabey is an animal model for leprosy. The cause used to be only one bacterium, Mycobacterium leprae. And interestingly enough, all cases all over the world in humans throughout time have been clonal. So it's very easy. People have been able to use the clonality of that and the very rare mutations of single nucleotides to trace where leprosy came from, which actually was in Eastern Africa, and then its movement around the world over the last several hundreds of years, where it tends to have followed colonial trade routes and slave routes. And it came into North America with the Europeans and slaves from West Africa, and the history of that disease is obviously extremely tragic due to the social stigma inflicted on the unfortunate people who have been affected by this chronic long-term disease. You can see there is trauma here and some loss of the, and it's been thought by many people that this particular agent causes body parts to fall off, and that's not true at all. What happens is actually Mycobacterium leprae and a new Mycobacterium which has been identified within the last 10 years in just a few number of cases in people, called Mycobacterium lepromatis. They both have tropism for nerves in the extremities, and they get into the nerves of the hands and feet, and the unfortunate victims of this disease lose feeling. And then they end up with these traumatic injuries, very significant traumatic injuries, because they can't feel anything. And that's where this sort of myth about losing body parts comes from. There are a couple of other animal models for or at least animals that can be infected with Mycobacterium leprae. One would be the 9-banded armadillo, and there have been a number of cases of zoonotic transmission from armadillos to people in the southern United States, or people who are involved with hunting armadillos or eating armadillos, or working with armadillos, I suppose. And then recently in the UK, there has been an outbreak of Mycobacterium lepromatis in red squirrels, which is causing a problem. So this is leprosy, and it's usually a disease of primates. You can also see it in chimpanzees that are susceptible to infection. So, okay, that is our 10 slides for the day. I hope that you did a great job with this. I hope everyone has a great weekend. And next Friday we'll have one more. I will be on vacation after that, doing some lectures in Australia for a couple of weeks. So we'll get one more number 10 before I take about a 3-week break. And I hope everyone has a fantastic weekend.